Yeah, time has started.
Hello.
Hello, doctor.
Good evening.
Hi, doctor. Good evening.
So I'm Dr. Rav. I'm one of the junior doctors here. Are you Mr. Amos Degree's son?
Yeah, doctor.
Mhm. So can you tell me what happened?
I, basically, I was just watching TV with my father, and
Mm-hmm.
suddenly he just collapsed. And
Mm-hmm.
I have no idea. It's the first time. Just I took him, brought him here in an ambulance, and
Mm-hmm.
that I don't know. Like a lot of people just running around. I don't know what's happening. Nobody's told me anything.
So was he watching only the TV?
Yeah, doctor. I was just sitting and watching TV.
Did he have any complaints before that? Was he running a fever?
No, doctor, nothing. He was completely fine.
Any headache?
No, doctor.
No. And after he collapsed, was he unconscious throughout till he reached the hospital?
Yeah, doctor. He didn't even. I was calling his name the whole time. He didn't even look up.
Did he vomit?
No, doctor.
No. Okay. Did he have any other medical conditions before?
He had hypertension and diabetes, and was controlled by diet. But
Mhm.
he had angina, and yeah, that's all.
Was he under medications for it?
Yeah, he was taking aspirin and lisinopril and simvastatin. Yeah, the three medications.
Hmm. Okay. And uh, did he have any surgical surgeries before?
Oh, no, doctor, nothing.
Any allergy to any
No,
medications?
no, no,
Uh, any history of similar episodes in the family?
no, doctor, nothing.
Mhm. And do you live with him?
Yeah, yeah, I live with him.
Mhm. I see. So, see, we've seen him in the emergency. Okay, as you said, uh, uh, he came unconscious. Okay, we've done a CT, and I'm afraid we don't have any good news for you. Is there anyone you'd like to be with you during this time?
No, what do you mean?
Would you like anyone to be with you?
No, I'm fine, doctor. What happened?
How much of the diagnosis would you like to know?
I don't know. Tell me everything.
He came unconscious, and we did a CT. We just did a CT, and I'm afraid it shows that there is a massive bleed in his brain.
My God, what does that mean,
I'm
doctor?
so sorry.
Okay, but what's happening? Like, I mean, we're gonna treat him, right?
Mm, look, a neurosurgical team has seen him in the emergency, and I'm afraid they've said that his condition is terminal. I'm so sorry.
What do you mean terminal? I mean, this is like a big hospital. You have everything. What do you mean terminal?
Mm, see, there are few things that even we as doctors we are unable to treat. You see, uh, and the bleed in his brain. It looks like it is because of a ruptured berry aneurysm. Do you know what it is?
No, no, doctor. But so you
Mm.
mean like there's nothing we can do? I
See,
mean, is he alive? Is he talk?
yes, he is. Currently, he's able to breathe alone by himself, but we don't know how long that will last. You see. because of the bleeding that's gone on in his brain. So, because he had a hypertension before, it seems like one of the blood vessels in his brain, you know, uh, it was weakened and all of a sudden it burst, causing a massive bleed in his brain.
Yeah, yeah. I mean, I understand, but what do you mean? There's nothing you can do. I mean, is there is
See,
right? I mean, why can't you just
yes,
put a tube or something? Have
yes. So what we're going to do is we're going to give him some medicines to be in pain, to decrease his pain. We'll also give him, uh, food through a tube, which we'll put through his nose into his stomach. Okay? We'll take all the necessary measures to prevent infections or, take care of his mouth. We'll change his positions in the meantime. We'll make sure that he's comfortable you know, before he passes away. That's at least what we can do. That's the least we can do.
I mean, what do you mean? You said you can do all that. I mean, he'll get better, right?
Uh,
Why can't they
I'm not.
just do surgery and remove the blood and all that? I know it can be done. Doctor, please, doctor, you have to do something. I mean,
You see, sometimes our hands are also tied. You see, we cannot treat every case. I hope you understand. The bleed in is massive, and the senior neurosurgical team, they've seen the case and they believe that it's terminal. We cannot do much more. I'm so sorry.
my God,
I can see that you're
how
concerned.
have doctor? I mean, he's alive right now.
Yes, he is alive.
How
What we're
long
going to do is, uh, we're not sure about how long.
he can?
We cannot tell you right now, about how long he's going to think. But all we can do is we can make him comfortable. We can
Okay,
make sure he's not in much pain.
okay.
That's the
Can
least we can do. If it makes you feel any better,
I mean, can I take him home? What is the what do I?
mm, we'll keep him in the hospital. We'll observe him in the ward for now because he's breathing by himself. Okay, we'll,
Do now? I
as I
mean,
said,
I'm alone. I can't. How do I live now without him?
do you have any other family with you?
The next station.
I for the first time without practice, this was amazing the way the way you did.
I don't know.
No, I did really well. I mean, I was being a little difficult because that's how most of the patients there are. But yeah,
Mhm.
you did really well. So yeah, the examiner will tell you like specifically. But yeah, hi,
Mhm.
Dr. Niveta. I'm sorry we waited for a while. It's okay.
I'm
We'll
really sorry, doctor.
no problem. No
I was
problem.
just coming home so I can get a Wi-Fi, but by the time I came, yeah,
I can understand. It's okay.
I'm really
So yeah,
sorry.
just watch the explanation of the examiner. I think that'll really help. Have you
Yes.
seen this case before?
Yes, doctor, I have seen it.
Okay, good, good.
But
Because
yes,
it's a
I
very
missed my
yeah.
opportunity.
No problem. No problem. We'll see. We'll see what we can do. Your exam is coming soon. I know. Yeah.
Yes, yes, yes.
Yes, yes. I'll email you. Yeah, sure.
Yeah,
Okay.
sure.
I'll
Thank you,
just ask
doctor.
you. No, yeah.
Hi guys, hi Dr. Rahav. Thank you for participating, and sorry, Dr. Nivedita. We'll definitely reschedule the mock with you and help you with that. You can fill in the form again. So if it's the same case you want, then it's all right. You don't need to. Then we'll reschedule it way before your exam. All right. Very well done, Dr. Rahav. This was his first attempt. I'd like to inform that to everyone. And he did very well. I have marked you a little harshly, all because we're trying to maintain that standard of, what would be marked upon. so that you keep that in mind. But I'll give you an ideal approach, and help you understand how to approach such a case, if it comes in the future. So when you're so I'll give you an idea of how you would ideally want to conduct yourself if this case comes, and what you would do in that 1.5 minutes that you have outside. So once you see this case, you know that it's a breaking bad news. So, meaning you already know the diagnosis, it's bad, and you have to talk to the relatives about it, right? So
Yeah.
there could be two types of scenarios in this. You're talking to the relatives, you can talk to the patient as well. If it's some cancer that you have to disclose, that you have to inform them of any cancer that they would have had. So that's another breaking bad news station. But in this particular station, one thing about breaking bad news is you already know the diagnosis. So there is no point in asking any further history about the diagnosis, right?
Hmm.
Like, how is your lifestyle, how is his lifestyle? But what you're trying to say is your father has had a bleed, and most probably it's because of the berry aneurysm, which is something that is mentioned. So these are all things you're collecting from the information outside. So you need to, that 1.5 minutes, it will be easy to read through the question really fast. And so you need to keep a mind of how you would structure your approach. So a couple of things that you have to talk about is that he's terminal. Might be because of, most probably it is because of this berry aneurysm. And any other concerns they have to address that. But since these two information has been given in the question, try to incorporate that as well. So when you're doing the data gathering for this particular case, you're trying to understand what could have led him to have that berry aneurysm rupture, right? So what we're thinking is, if he has had any underlying medical condition, was it managed well? Was he taking any medications? Those are the only important things that you should actually have gathered, right?
Hmm.
Because and what happened immediately, what has happened so far for you to bring him to the hospital immediately. Because every
Hmm.
other question, otherwise it would be because that would cut into your time, because you have so much to explain. So that's why
Yeah.
management is going to be long here. So you'll have to keep a mind of that. So
Yeah. Sure.
couple of ways you have to say it. So in a breaking bad news, usually what is used is something called a spikes protocol, right?
Hmm.
So S stands for setting, meaning that usually in a hospital setting, when you're talking to somebody who you're going to give such a bad news to, you would want to be in a quiet room without any disturbance, so that you can address their emotions properly. So hence setting is important. Over here, we emphasize on setting because you'll need to, when you approach the person, you need to explain them why you've approached them. You can't just go and talk to them like, tell me everything you know about your father. Like you're just talking to an anxious person who just saw their father go unconscious and not respond to them. So you have to come in and introduce yourself. Say, I'm Dr. So and so. I'm from so and so department. From so I've come to talk to you about your father's condition, right? So you're
Hmm.
not telling them that it's bad. I'm extremely sorry for that. Right. So you're not telling them yet that it's bad, because you're trying to do data gathering in order to layer your information. Like slowly tell them why you think it is so, right? So when you start with this, so settings is important. So SP. So P comes with perception. So what do they think is happening? So usually when you're approaching a case, especially a symptomatic case, if a patient is coming with a symptom, you usually have a ICE approach, where you try to understand the idea they have of the condition that they're suffering from, right? Over here, it's
Hmm.
almost the same thing. You're trying to understand their perception. So could you please tell me what happened so far, so that we could be on the same page, something like that. So then they'll tell you what has happened, like he went unconscious, and I brought him here immediately. I tried calling out his name, he didn't respond. So the questions you asked around that, about vomiting and is he having headache, was a good question, because very aneurysm could be something subarachnoid and all that. So headache, you would have understood, okay, fine, he just had it. But asking him if he's vomited and all, yeah, it would be a good question. But you already know the diagnosis at this point. So to see, so vomiting,
Mhm.
you try to see head injury CT criteria, right? But
Mhm.
that's an unnecessary question over here, because you know how bad it is, and you're just trying to understand the cause. So headache would have been
Yeah.
to assess how bad it is. So that was kind of an
Yeah.
unnecessary question that would cut into your time. So right. So ask him, okay, so you understood what has happened so far. Now you just need to correlate the aneurysm to something. So just ask him, did he have any medical conditions, so that you would be better able to explain what has happened to him. So
Mhm.
he'll say, yes, I had so and so medical condition. All right. Is it been managed? Because if it's not been managed, that's also one of your reasons that you could mention that, his aneurysm got worse or something like that, right? So he'll say, yeah, it's managed well with all the medications. All right. So far you understood that much. So now you have to break the news. So when you're breaking the news, SP. So you finish P. I is the invitation. So you'll have to tell them. Before that, so a couple of investigations have been done, right? So you need to ask them, has anybody come and spoke to you about them, or do you know anything that has happened in the hospital? Like, do you know what
Mhm.
has happened so far? Has anybody come and explained them to you? Because if there is a conflicting information there, then it might not sound good. And it's also something that can save you time. If he says something like, no, I don't know what investigation happened, or if he says, I do know what investigation happened, then you can move on to the next point that you want to make. So if he doesn't say
Mhm.
that, no, I haven't, don't know what the investigations are, then you'll have to explain them. All right, we did a CT, and okay, so that is also an important point to make the diagnosis. So then start with the invitation. So all the time when you start thinking that this point is important in me revealing the diagnosis, then just before that, start with the invitation. So start by saying, all right, would you like anybody to join you as I'm telling you about your father's condition? So then usually that question does startle people, and there is a way to recover from that. So they'll be like, why, what do you think, why are you talking to me like that? So then just come back to your normal course of actions, like, you see, we did, when your father came in here, we did a CT scan, and that has shown that there has been a massive bleed inside your father's brain. All right. And this is most likely because of his underlying conditions like hypertension and diabetes he's been having. And that has resulted in something called an aneurysm, which is an inflammation of the vessel, where the vessel has gone weak and it has ruptured, which has caused the bleed, right? Our
Mhm.
seniors, our specialists from neurosurgery have come in and taken a look at this case. And after assessing him, they have found out that the bleed is too massive for them to do anything. All right. So, unfortunately, at this point, I have to say that your father's condition is terminal, right? Once you say that, so that means literally when you say your father's condition is terminal, you have to wait for their reaction, because throughout the station, one thing you didn't do is you didn't give them enough time to react. Because
Mhm.
now, after they react, that is what your response is going to be, a response to the reaction. So your response should be tailored to what the reaction of the the simulator or the person you're talking to. They'll be like, what do you mean terminal? I mean, what are you trying to say, doctor? So you'll have to be really calm at that time, and say, I'm so sorry, this might be very difficult for you to take. I can totally understand. Say such comforting words, some comforting lines, so that you show solidarity, you show empathy, right?
Mhm.
So there is an important protocol called the Eve protocol when you're actually doing that. So you have to see their emotion, what their emotion is, validate it, saying that, yes, I'm so sorry, you must be going through a lot, and empathize with it, right? I can totally understand. I'm so sorry for you. When you have that, then they'll be a little more calm when you talk to them about anything further. Usually that is what really happens. So
Mhm.
after you say that, then then they'll be like, I don't know what to do. And then you can tell them a little extra, whatever the questions that follows. So they'll be like, what do you mean terminal? Like, I'm so sorry. Your father's, I don't think our team of doctors, after assessing him, are not of the opinion that he will, regain consciousness after this. So then they'll go into a lot of other questioning, like ET tube and feeding and all that. So you'll have to say that, unfortunately, so whenever they bring in a procedure, one thing you can do is you can tell them the risk versus benefit for that. So you can
Mhm.
say that ET tube is something that is going to be very uncomfortable for them, and once intubated, there is no chance of recovery. There's most likely no chance of recovery, and so that is something that we wouldn't want to put your father through, especially at this stage. He's breathing on his own, right? So giving them all that information, then they'll be like, all right. I mean, you'll have to reason with their information. So when they bring in a question, you'll have to reason with them and give them a reason for why not. All right. So and then after that, most probably they'll be like, what do I do next? So whenever you're thinking end of life, you have to talk about everything that you have to talk, everything you have to incorporate within end of life. So couple of things, like, do you have any relatives? You can call your relatives, and they can see them for the last time. If you're willing, immediately we can introduce, we can bring you to your father, if that's all right. And call in your relative. So some of the questions will be like, I don't know how to talk to my sister. I mean, she's in Australia, I haven't told her, I don't know how to say. So then you can always offer help and support, saying that if you'd like, I could help you in breaking this news to her, if that's all right. Right. And the next thing you need to know, or the next action item after this, is what happens after death, right? So you need to know what will happen after death, usually in a hospital, right? So you need to, for you to know that, you need to know what are the patient's wishes. So that's why you need to always ask for an advance directive, because this is already end of life. So that is something that you need to know when it comes to the patient itself, who is in the final stages of his life. And for the relative, what you need to do is the bereavement services, right? Because to help
Mhm.
them. So bereavement services is something that helps them organize funerals, to deal with their emotions well, right? Like what to do with the body next. All that comes from the bereavement services. So that's how you have to direct them. So even though you have said the news, you have mentioned what is going to happen, you have to end the case. So these are the ways, these are the directions you have
Mhm.
to do when you are coming to end of life. I mean, end of life meaning death.
Yeah.
Right, exactly.
Yeah.
So, what the treatment right now is, we'll keep him comfortable, and make sure he's not in pain. But there's nothing more that we can do medically to help his condition recover. But unfortunate, and then talk about the terminality of this whole thing. And then I would just like to know, did your father have any advance directive? So it'll be a yes or a no, because organ donation is also something that is important in this case. So if
Mm.
he has an advance directive, he would have mentioned, in such a situation, if at all I'm in such a situation, then that is something that I consent for. Or else, you have to check the advance directive to see who is the next of kin that that decision goes to, right?
Mm.
So to those people, you'll have to ask this difficult question.
Right.
Those are the things you're trying to find out when it comes to, so that you see, management has so much. So if
Mm.
you spend time in data gathering, you won't come to all this. So data
Yeah.
gathering has to be short and crisp. So management, all right. So perception. So we were talking about the spikes protocol. I'm sorry, I went a little off. So I was invitation, and K is the knowledge of what you are going to tell them. So that is about the terminality of this, the CT scan. How you break it in layers is what matters, right?
Mm.
So starting from your dad came in, we did a CT scan. It's most likely this, and I support that it's most likely this, by because he had a long-term condition and it was sudden. So it most likely is this, and surgeons have seen that they can't operate. So those are how you break the thing in layers, like one thing
Mm.
leading to the other. So you see the immense work we've gone into to tell you that it's terminal. Like, we're not just saying that out of nothing. All right. And so before leaving every station, that is something that we try to tell everyone: always do three things. So, which is safety netting, follow up, leaflets, pamphlets. So, what are all these aspects in this particular case? So, safety netting over here will be to the relative. So, you'll have to offer them bereavement service or something like that, because at this point, their mental health is also at stake. You don't want anybody who leaves from hospital to be going down a path of depression, or not knowing what to do next. So
Mm.
before they leave the hospital, you will have to always give them that information. What is to be done next, if there is anything that you look out for. And just so you're informed, I'll give you some leaflets and pamphlets, so that you will be better equipped with the knowledge of what to do next, right? So safety netting over here would be bereavement follow up. If they want to talk about anything further, if they go any doubts they might have had about this condition, so you can always reach out to anybody in the hospital, within our team. And leaflets and pamphlets. Here are some leaflets about bereavement services and end of life care. So that they are better understanding of what is happening at that time.
Right.
Right. So that was an incredibly good try for the first time. I totally applaud you and